what's up, Goofies? Goofy-ers and Googets. Oh, shit, hold on. There's a problem right there. Phone not charging. All right, let's hop right into it. No time to waste, guys. Why the health care costs are so high in America? I'm curious to know that shit, too. Get to the bottom of this. Let's go.
The Joe Rogan Experience.
And then healthcare. Like,
did you see the thing I posted a couple weeks ago about this bill we got from when Jill was with our middle son in San Diego visiting a friend, and he was sick, so she had to take him to an ER, right? Like our doctor's not there, right? Obviously,
okay.
We live here, so they did like regular chemistry lab on him. That's like about a $12 blood test, and gave him like, I don't know, 250 to 500 cc of IV fluid. That was it. What do you think the bill was?
$1,000.
$1,200.
I don't remember because I have to look at the post I put up. I think the bill was $6,000, of which we owed $2,000.
That's insane.
That's problematic.
That's a real problem.
Yeah, it might have been more than that. $6,000 bill. Our insurance somehow picked up maybe $3,500. We were stuck with $2,500. Now juxtapose that with the following fact: fewer than 50% of Americans today, if given 24 hours, can produce $2,500 in cash.
Jesus Christ.
So when we say healthcare is the leading...
Whoa. That's fucking huge. That's fucking huge, man. Fewer than 50% of Americans can produce $25,000 worth of income. $2,500 worth of income. Just to pull it out their ass. It's deep. That's really deep, y'all. If you think about it, is anything in this country, like when you buy anything, right? When you put a down payment on a car, you at least have to have $2,000. Like, whoa. That's why listen to this, y'all. I believe in this, right? And listen to me on this. If you can, stack up 10K. Before you leave your mom's house, before you get out of anything and start going into the world, stack up $10,000. And ride your income not off of the $10,000, but ride it off of whatever income that you get. I'm gonna tell you why. At $10,000 and you maintain that $10,000, all of your problems will go away. Like, genuinely will. Like, anything that goes wrong, that $10,000 will always be there to back you. So, like, for example, if I take trips anywhere, go anywhere, do anything, I've done it before multiple times. There's always that extra 10K I got in the bank, no matter what. And I've been stacking it. I've been stacking it since I started working. When I started working, I was like, I'm just gonna stack money. And then a couple more things happened, and I got the 10K. But ever since I've been at 10K, I've always been like, I'm gonna keep the savings at least at 10K. I don't tell nobody that. So that's my big secret. So I always got money. Always. But that's crazy, $2,500. And but I live like I'm poor, for sure. But still, 10K don't mean you're rich. You know, it's just I think like everybody, if they had that, if something goes wrong, your car breaks down, you need new tires, you need a new car, you got that money that you can put a down payment down, plus your car. Live like you're poor, stack like you're rich, I guess. And then spend when you get to a certain point like you crazy. Like when I make $1 million, I'm blowing money. Like I'm blowing money. I ain't gonna blow money, but I will have a lot more money. Let's go.
Cause of personal bankruptcy, it's the first, second, third, fourth, fifth. Like there's nothing else matters besides healthcare when it comes to personal bankruptcy. I mean, this does infuriate me to no end. Like I sometimes think, like, is there any other problem I would ever be interested to devoting my full attention to besides the problem I work on now? That's the only other problem that would tempt me.
You know what's interesting too? If that problem was really tackled by our government and they did it in an efficient way, one of the ways they would have to do it, one of the ways they would have to address it in order to be efficient would be to encourage people to become metabolically healthy.
Of course.
We have zero encouragement. Zero. In fact, there's actually the opposite. There's encouragement for people to have body positivity and to not be fat phobic and to not fat shame.
Hold on a second, y'all. Getting up from that chair hurt my leg, babe.
Why?
I don't fucking know. All right, back. Sorry, y'all.
Same, you know, and there's zero discussion about healthy diets and vitamin supplementation and the benefits of that. If they just did, like, imagine if the government was responsible for our healthcare, and they realize, hey, guys, like, we got a real problem here. We're spending too much money, and we're losing money because what if the amount of money that they made was dependent upon the percentage of money that was spent on healthcare? Like, imagine if politicians, if their salary depended on the, like...
See, but I fear that would still get screwed up, because then they would just cut costs, right? Like, I feel like...
What if that wasn't an option, though? What if,
Well,
like,
the problem is
like
we have to cut costs. This is the problem, right? We're probably up to $10,000 per capita, which is, I mean, we're actually probably more than that. We're probably $12,000, $14,000 per capita. So we're at 2 to 5x every other developed nation in what we spend on healthcare.
But why?
And we get worse outcomes. Okay, so the big reason comes down to made-up numbers. Look at my ER example. The blood test cost, the actual cost of ordering that blood test is $12. The bag of IV fluid is probably $38. So why do they inflate the cost so much? It's because they play a shell game with the insurance company. So they say, we negotiate different rates with different insurance companies, and we're gonna build up the price enormously, but we're gonna offer you a really big discount. And we're going to make you our preferred network. We're going to be your preferred network, and there's a quid pro quo here, which is the price is enormous, but you don't actually have to pay that much. We're going to,
which is all capitalism,
discount it to you. But if somebody comes in out of network, which we were, right? We were out of network because our network is optimized around being in Austin and not in San Diego. You're going to get screwed. And of course, if you don't have insurance, forget about it. You're paying the fake money price,
especially if there's a real injury.
Oh, yeah.
A real injury, you need surgery, and you're not insured? Oh, my God.
The other thing is, we don't have the same laws around, like, drug pricing, right? So drug, the United States basically subsidizes the rest of the world in drug pricing. So we, in exchange for getting first dibs on the best drugs, we pay a higher price for them. And other countries are basically not going to pay that, because you also have better purchasing power. So if you look at Canada, for example, like, the government is buying the drugs,
right?
Not the payer, right? So it's a totally different system. And the challenge is, no system is going to be perfect. But what really bothers me about the discussion is we're missing the point that there are 3 variables that need to be optimized around, and everybody just talks about their favorite one. But you can't talk about one without talking about the other 2. Because if you pull on one lever, you got to let up on one of the other levers. So the 3 levers are cost. How much does it cost to deliver this care? The second is quality. How good is the care? And the third one is access. How many people fall through the cracks? So if you look at the United States, we're very good on quality. When we deliver care, it's the best. There's a reason people come from all over the world here when they need their cancer surgery, right? We are certainly at or above the best for everything that would be done in medicine. On cost, we are absolutely the worst. There's literally no country that pays more than we do for a given service.
Wow.
And on access, we're horrible for a developed nation. Horrible. Right.
On cost, like, what is the difference between, like, say, United States
and Canada?
Yeah.
2.5x, I would bet. Wow. Maybe 3x.
I got literally so much to say that I have literally nothing to say. So it's a battle between insurance companies, and the insurance companies jack up the prices in order to make it more expensive for whoever buys it with whatever insurance they're buying. And if you come from out of service, you don't have an insurance, you're paying the full jacked up price. That's the first thing. The second thing is, we're not good on cost or access, but we're good on quality. So when you get somebody in, the quality's good. So he said you have to pull on levers, But I'm like, how many levers are you fucking pulling on if the only thing we have is quality? Like, if the quality isn't accessible and the cost is not cost worthy for us to be able to even get it, is the quality even worth it? That sounds like crazy to say, but really think about it. If you can't even get care, like in some countries where the quality isn't even that good, like they're getting the care. Like, but I think ultimately, I don't think y'all realize what he said. The whole insurance company battle thing. Y'all hate Obama so much, but he was trying to tell people this. Insurance companies were charging people with pre-existing conditions that they weren't allowed to get care. And what they were trying to do was create a government system that was competing with the insurance companies in order to make it simpler for people to have health care. What was expensive about it was that it was coming from taxpayer dollars directly. Insurance companies get money based on people who signed up for their insurance. So if you're signed up under Medicare or whatever, not Medicare, but let's make up one, healthcare, right? You have 1,000 people signed up under there for $50 a month, right? That's paying for all the other people when they get sick or when they don't get sick. It's just coverage for whatever happens for that. But if you have the government all forking out money, that requires the citizens to fork out their tax dollars in order to pay in the insurance, right? That is a better program than any of the insurance companies have private access. Or if the insurance companies have private access, limit the ability of what insurance companies can do. Which is everything Obama was trying to do. I know all about this. Definitely. I don't know all about it, but I know exactly what he was trying to do when it came to the health insurance part. I can learn so much more. But yeah, that's kind of bad what he just said. But anyways, let's keep going. This is good.
Wow. Yeah, that's so crazy. And that's not like a third world country or something like that.
Right. So Canada is killing us in cost. They're killing us in access because everybody's covered.
Yes.
But we have better quality. So you have to. So
right.
that's the trade-off. Like,
right.
I mean, I do talk about how my mom is getting largely veterinary medicine in Canada. I mean, like her healthcare is horrible as far as I'm concerned.
Yeah,
totally
I've
unacceptable.
Many friends in Canada that have complained.
No, it's totally unacceptable.
So they have bad care. But
at least everybody gets it, and it doesn't cost you any money.
And is it bad care because the physicians are not incentivized to provide better care because they don't make as much money?
No. So first of all, I mean, at least I don't want to speak out of school because I'm so far removed from it. But when I was growing up, they had introduced salary caps. So physicians' salaries were capped. So when you hit your cap, you stopped working for the year. So high-earning surgeons would stop working in August. Because they'd hit their like let's say the salary cap was $300,000. If you earned $300,000 by August, you weren't going to get paid anymore.
So they would just sit down and sit out the rest of the year.
Yep, and come back in January.
It would create this real problem where there's a bottleneck.
Shortage of dogs.
Yeah.
But the bigger issue is just that the government is in charge of what gets done and what does not get done. And there's sort of shortages, right? So if you, like things that you and I take for granted, right? If you tweaked your knee at jiu-jitsu tonight, you go get an MRI tomorrow. That doesn't happen in Canada. In fact, in certain provinces, it's illegal to have private clinics where you can go pay out of your own pocket to get an MRI. Expedited.
Oh my God, it's illegal?
Illegal. I think Ontario is one of those provinces, by the way.
Really?
Yep.
So Toronto.
In Toronto, I do not believe it is legal to have private medical clinics where you can pay out of pocket. So this is where, when people say, oh, we should just be like Canada, I'm like, no. We should do something Canada does. We should have universal coverage.
And then have the option.
And then you have the option to bolt on.
Yeah. But would that be sort of like public defenders versus a really good attorney? Like, because
no, I don't think it would be.
Suck.
Yes, of course. No, I think one of the things you have to do is provide primary care and emergency services for free. Because that's where 90% of your care would be delivered.
And is the problem that because of these made-up numbers that you discussed earlier, that these people, in this country at least, are accustomed to charging these exorbitant fees, like $6,000 for a bag of IV?
Oh, yeah. Like, I mean, I get a colonoscopy every 3 years. So I had my last one this time a year ago. And, because it's funny, that one should have been covered. I don't remember the details on it, but because I was over 45 at that point, so it counted as a screening colonoscopy. But I've historically always had to pay cash for my colonoscopies because I started doing them when I was 40. And the cash cost of getting a colonoscopy at like one of the best guys in New York City, who I've always gone to, is $2,000. That's the fully loaded cash cost. That means that's covering the facility fee, the anesthesia, his fee, etc. The one I got here in Austin, where I did it through insurance, the fee was $6,000. I got the bill, and my insurance picked up. Maybe this is the one anyway, my point is my cash out of pocket was almost as bad as the cash I paid for just a full up cash one. It had a whole bunch of made up numbers. I actually called my gastroenterologist, the guy who did it, and I was like, you got to walk me through this. Because I'm struggling to understand these costs. And he couldn't really explain it. He's like, yeah, I mean, I don't know. I don't really understand it. He's like, but everybody has sort of a different amount. It's like being at a bazaar where it's like, oh, I have special price for you today.
That's extremely interesting. I know somebody in Canada right now, where they have Crohn's, and it's interesting. So I wonder if the proper care is being given in that scenario. A couple people in Canada actually. That's funny. But they do complain about the healthcare system there when it comes to the accessibility. But yeah, I didn't know they weren't allowed to have privatized healthcare there at all. I think that's a problem, because privatized healthcare is where the quality comes from. And if you could privatize certain systems, it wouldn't always be somebody going for something specific. They'd have to go to specific things for specific reasons, and the cost would be ineffective for that. I don't know. We'd have to see. I'd have to see a spreadsheet across the board of how all this would go. Interesting, they use the word bottleneck. It's something that me and somebody else in January are going to really hear a lot in our day-to-day work, in our supply chain work. Bottleneck. I don't know. That word is just funny. But anyways, for those of you who don't know, bottleneck is if you have a shortage of something, that's what they call the bottleneck. But anyways, off topic. That was a great one. I really like that one. Come on live and let's all have a discussion about this, a debate about this healthcare. So I'm out, y'all. Bye. Shit.